So welcome back to the second session. Last week, we started with the fundamentals of public health. We focused on the upstream and downstream parable to understand how we can provide care at different points of intervention along a spectrum. And that in the United States, we typically sort of push everything towards the saving drowning children side of things. And we don't spend nearly enough on preventing those children from being in the river, figuratively. Then we jumped into the Frieden public health triangle, which lets us predict what interventions are likely to be most effective. And I thought we'd pick up there for today to go back to our hypothetical child with asthma. So let's see if I can pull up that that slide. Let's go back a few. Oh, wait, here we go. So this child with asthma, we were talking about, what can you do to sort of prevent the asthma in this child? And last week we used the example of tooth decay to sort of populate the triangle. So we could try that again with asthma to see if we can sort of predict what might be most effective for solving this problem, which probably comes up on a more regular basis in your professional lives. Whiteboard, here we go. Actually, you know what? Cancel the whiteboard. Instead, let's go back here. And I'll just write on this screen directly. Okay. So education, if you remember, is really just telling someone something. That's it. There's no inherent action. You've just said something, or maybe you've given them a sheet of paper, whatever the case may be. But what would be an example of an educational intervention to prevent or treat asthma?
I know at the hospital we have like an asthma nurse educator. So she like scours the board basically to see patients that are there for asthma or potentially have asthma for like any other related cause. And then she goes and does like an asthma education plan with the family and fills that out with them and stuff.
So it's got the word education right in there. So yeah, providing information. Now, even though this is likely to be the least effective on a population level, it would be unethical if we withheld that information from patients, right? Of course, you want to tell them everything you can that might be of use in managing their asthma. So you want to talk about triggers and when to use your rescue inhaler and how to use a spacer and all that good stuff, right? That would be unethical if we did not provide that information. We just have to acknowledge, wait a minute, if we're trying to prevent asthma for an entire population, maybe there's something else we could be doing too along that upstream, downstream continuum. Okay, so clinical care. Does anyone remember how we define clinical in this model? Because it's different than sort of everyday usage of the word.
It was like people have to do something every single day for like the rest of their lives.
Yeah, basically, right. Or at least, no predetermined endpoint. Who knows how long it'll take, but yeah, every individual, every day for who knows how long. So what's an example there for asthma?
I guess if they have like any sort of maintenance inhalers, then taking those every day. But for people who don't have asthma as severe, I would think like identifying your triggers and just trying to avoid them.
Yeah, I think those are both great examples. So obviously the medication, one of the weird things about this word clinical and this usage is that it often really doesn't require a doctor, except, maybe to prescribe the medication. But the clinical aspect of it is you, the patient, using it on a daily basis. And then, Sarah, you also mentioned, identifying your triggers. And avoiding something every day also counts, just like you might choose not to smoke a cigarette every day. Or if you're talking about kids with asthma, trying to not go to your friend's house and they have a cat, right? Whatever the case may be, it's on you. You have to do it every time that it comes up. And that's true for everyone who's in that situation. They have to do it for themselves. Great. Okay. So one time long lasting, obviously the difference here is that we take a little bit of the burden off the individual by asking them to do something once that provides long lasting protection. So you don't have to do it so regularly. So what's an example there of something we could do for a child with asthma? And I would, sorry, go ahead.
Offering like ends up being partly socioeconomic, but like a lot of times they have issues with their house. So it's like if they have pests or mold. So it's like if you fix that problem once, it'll probably help them for like a while.
Exactly. So, if one of the triggers is mold allergens and there's a broken pipe behind the wall and it's leaking and that makes the wall wet and that makes the mold grow and that makes the asthma bad, then if you fix that pipe once, then in theory, you get long-lasting protection. Exactly. Fix the pipe. Great. So as we mentioned before, these top 3 tiers all put the burden on each individual in your population. And that's inherently why they're not as effective, because it's really hard. I mean, there's efficiency problems too. It's inefficient to have to reach every single person. And even when you do, the expectation that they are listening, that they can prioritize this, that they will prioritize this, that they have the resources to accomplish whatever you're asking. I talked about sort of the reverse Swiss cheese model, right? All the stars have to align for the good thing to happen for every person in the population, if you want this to be effective at the population level. So then we dip below the dotted line to find the magic of public health, where we can change the context. So does anyone remember how we sort of defined this tier of the triangle?
Doing something that people don't have to think about. So changing like the environment in some way, like they put fluoride in the water so that people don't have to do anything for it to help.
Exactly. You'd have to work against the default to do the bad thing, because the good thing happens automatically for everybody. So how could we do that for asthma? What do you think?
I guess like reduce environmental pollutants, like in an area where there's like a lot of asthma.
Exactly. So as one example, I work in East Harlem, where there's really high rates of asthma. And it also is where the trucks all go up First Avenue through East Harlem to the Bronx to pick up food or make deliveries from the warehouses in Hunts Point, or to dump off all the garbage that they're hauling up to the waste transfer stations up there. So it's like a default truck highway on one of the regular avenues, because they're not allowed on the FDR. So if that was to change through some type of policy, let's say magically we transformed everything into electric vehicles, or we redistributed the sites so that they're more equitably distributed across the city, so you don't have to go just to the South Bronx, that would be changing the context. So let's put down reduce vehicle exhaust by policy.
I also thought, even though it was not done for this purpose, like the fact that we made smoking in public areas basically like very uncommon in like restaurants or like a lot of housing, hospitals probably helps too.
You're exactly right. So these things that operate at the change in the context level typically involve policies, regulations, laws. So when you mentioned all the laws we put in place to reduce smoking, that's exactly right. That's why they're so effective. They're not They're not necessarily popular, especially when they start, especially when the discussions are starting about even making a law. And they're not easy to put into effect. But when you do get there, they're highly impactful. Okay, so now we've hit all the top 4 tiers. We think we're making some progress, but then we sort of realize that, wait a minute, we've exposed the disparities within our population, because how come these people are having higher rates of asthma still compared to these people? Even though we may have dropped it overall for everybody, now we can really see why, what we would call an injustice in the rates. So how would we really get to the root causes of who's going to be expected to get asthma, and how could we change that?
I think last week we had started to talk about like the universal income as being something that would be very useful for asthma, because most of the things that like exacerbate it or cause it are related to like low socioeconomic status, environment. So probably something like that could help.
Absolutely. So down here, I like to put it into terms of capital. So there's financial capital, and then there's social capital. And the financial capital obviously includes your monetary wealth, but that also quickly brings in quality of the housing, food security, quality of early childhood education. It's not education like the top here where you're telling someone specific information. Like, it's not like, hey, stop smoking. It's more like the ability to have a maximally developed brain from ages 0 to 3 that can then function at maximal capacity as you age into adulthood. So you don't need to be told not to smoke, because you just don't smoke by default. So way down here, that's the monetary side. And then the social capital side is things like racism or political empowerment. So if you don't equitably distribute all those fundamental resources at the very bottom of society, then you will predictably have people who are suffering disproportionately. And as you mentioned with UBI, UBI is not specific to asthma, obviously. You don't think, I have a child with asthma, I better write a prescription for $1,000 a month to the household. I mean, that would be really amazing if we could, although we do want to wait to see if the data shows that it's actually effective in the pilots that are going on. But if you did that, if you were able to do that, you wouldn't just be impacting the asthma. It's so fundamental that you'd be impacting the asthma and the obesity and the diabetes and the hypertension and the mental health issues and the substance abuse and the teen pregnancy and the school performance and the lifetime earnings, et cetera. You sort of set them up for success in all health and social metrics. So that's why it's so powerful, but obviously it's the most difficult to do. You really have to change the way society is functioning when you do this. And there are obviously lots of obstacles. So there's the triangle. We just put it into action with asthma. So let's move on to some new content as we segue over to the fundamentals of pediatric environmental health. Let's talk about this graphic for a little bit. I'm going to put it in, I hesitate to say simple, it might even be simplistic terms, I have to admit, but for the sake of conversation, let's do that. The blue part of every bar is environmental. The red part is genetic. This is based on twin studies. So it's basically trying to give us a foothold to orient ourselves in terms of the causes of disease. Now, ischemic heart disease, that's the #1 cause of death in the United States and around the world. And, you hear the archetypical story of, let's say, some 58-year-old guy who comes in for a visit and, his blood pressure is running kind of high. his cholesterol is not looking too good. The doctor says, you know, you should really start taking this med and that med. The guy says, yeah, you're right. Cause you know, heart disease runs in my family. You know, my dad died in his 60s. My uncle died in his 60s. You know, I'm getting to that age. It runs in my family. And that may be true, right? There is certainly a genetic component to some heart disease. But let's not forget that it's not the whole story. So somewhere around 80% of heart disease is not due to your genetics, not because it runs in your family per se, but because of what you're experiencing in the world you live in. Now, it's pretty easy to say, well, smoking, right? That's one huge factor here. But it's not just personal habits like smoking. It is the air you breathe itself. And you do not have control over the air you breathe, right? We all know those pictures, you know, Beijing or Mumbai or even Los Angeles, wherever, where you just see the smog, the haze of pollution, limiting the visibility. And that's what people are breathing. So it's really not the lung disease that's the biggest problem with that. It's really that it causes heart disease. And that's where we have to pick up the conversation here, talking about this blue section. It's the world around us, which is largely human created, that determines what diseases to what extent. So that's interesting. That's plausible for heart disease, but take a look at all these others, which are all cancers, right? And let's go to breast cancer as an example. In your medical training, of course, you always hear about the BRCA, right? Oh, BRCA gene, you know, runs in my family again, right? Yes, that's definitely possible. But even more starkly, 90% of breast cancer is not due to an identifiable genetic cause per se. It's due, again, to the environment. So, you know, if you got your plastic water bottle, reusable water bottle, and you bought it at the store, it says BPA free on it. What the heck is BPA? It's a plasticizer that is linked to endocrinologic, how do you say it? What's the right pronunciation? I'm losing my language. Anyone take a stab at that?
Endocrinology. I have no idea.
Anyway, things related to endocrinology, diseases like breast cancer. That's going to really bug me the rest of the day. Anyway, so it's these factors in your environment that are predictably causing serious disease and death. It's not simply the genes like fate, right? We can't just say, oh, it was fate. There's nothing we can do about it. Interestingly, where does the research money go? Like NIH money, if you're applying for a big grant, you know, typically it's going towards identifying novel genes and gene therapies. But that's really the smallest portion of the big problem, which is really about society. And again, you know, putting it back to the triangle, if you're saying, hey, patient, you should do this, this, and that, take this medication, take this therapy, treat your breast cancer, try to prevent it, you know, using some untested therapy. That's top of the triangle stuff. Telling someone, expecting them to do something repeatedly for the rest of their lives. Whereas the most effective would be, hey, let's remove all plasticizers from our products. I mean, that's not easy to do, but that would actually reduce the overall rates for society, as an example. Or even if you just got rid of smoking altogether, right? There's still plenty of places in the country and around the world where tobacco smoking is highly prevalent. And if you just basically outlawed it, raise the price, ban the places you can do it, et cetera, you could reduce breast cancer, basically all these cancers to some degree, right? Anyway, that's one way of looking at the idea of environmental health, that it's really not about genetics so much as the world we've created around us. Here's another way of looking at it. So we have, I don't know what it is, maybe 7 billion people in the world these days. About 50 to 60 million people die every year. And this is non-COVID years, just a regular year. You got 50 to 60 million people who just die, right? And a few more than that who are born every year. That's why the population is growing. So of those 50 to 60 million people who die every year, what are they dying from? So this was an effort to categorize that. And they use the terms risk factor and cause. So total pollution is the number one of those things, right? They generously took tobacco smoking out of that category just to have a more fair assessment, right? Okay, take tobacco smoking as its own thing, and you could call that an environmental problem. But just to be extra conservative and fair about this process, let's take it out and see what's left. And total pollution, which means factors in the air, the water, and the soil, those still account for the plurality of deaths, right? It's the number one single factor, if you want to call it that, more than any of these other things, almost more than the rest of these combined, except for tobacco smoke. So we do have to acknowledge our responsibility for our species' health outcomes as a civilization, because total pollution is really based almost entirely on the world we've created, either by intention or as a secondary effect of all our technological progress. So there we are. That's the world we've created. This presentation was titled Simple Steps, originally just to convey the idea that if you are dealing with a parent or an older child who has concerns about something in the environment, right? And that's a big category, the environment, and something that might be causing them harm. Maybe, some kind of product at home, or maybe some factor that's going on in the school or at work, whatever it is, it can be really overwhelming really quick. So the idea here is that we want to distill things down to what's important and practical to do something about. So simple steps, meaning don't worry. There are actions that we can take as clinicians or the family can take to minimize the potential harm from whatever it is. All right, so we're starting with this arbitrary ad from the internet about detox water. And, I'm sure you've seen clickbait things for similar stuff. And I pulled out a quote at the bottom: detox water is one of the most popular tools for weight loss to come around in a long time. And for great reason. Not only can you drink detox water to lose weight, it tastes delicious and helps flush your body of toxins. And then what do you see at the end of that sentence there that suggests there's something more to be said?
There's a reference.
There's a reference, exactly. So it actually goes somewhere real. It's a Journal of Clinical Nutrition. And as far as I know, this is a respected peer-reviewed journal. We can depend on the information here to some extent. But let's look at what the article is actually about: the association between water consumption and body weight outcomes. And if we go back to the previous slide, how does that compare to what's being claimed in this advertisement? So again, here we have association between between water consumption and body weight versus this. Where's there a discrepancy?
They're talking about like the just drinking water in general versus this is a detox specific type of water.
Exactly, right. And this detox water apparently is just water with some fruit in it. So, it's a little bit suspicious about whether that's going to do anything special to you at all besides hydrate you, much less lose weight or detoxify you. So, if we look at this paper even, let's jump to the conclusions. We'll cheat a little bit and just go right to the conclusions. Take a minute and read that. And then tell me what your impression is about the reliability of this information.
Basically says no good quality studies, so not much we can really rely on.
It's, it's a single, it is a systematic review, which is nice. It's better than having a single study. But yeah, as they say, garbage in, garbage out. If all of the individual studies have unreliable data and you compile it together, that doesn't make the data reliable all of a sudden. The evidence is still low, lack of good quality studies. So we can't really conclude anything about even the simple premise that drinking water will help you lose weight, much less make the assumption that you can flush your body of toxins. But, I think we can all, we all probably know somebody, or maybe we've done it ourselves, someone who's been concerned about detox or cleanse of some sort, someone who's participated in some kind of dietary regimen, or maybe taken some kind of supplement to remove something in their body that they might call a toxicant. I'll talk about the word toxin versus toxicant in a minute. But making that assumption, what are they trying to remove from their body? Does anyone have any ideas? This is not a rhetorical question. I actually don't know what these toxins are. Any ideas?
I think a lot of it is kind of like pollutants from the environment, or things that they eat that are not really digestible, that kind of stick around, kind of like plastic, like little particles.
Oh, interesting.
That's my thing.
Sure, it might be. Yeah, plastic's a hot topic these days. There's little news articles here and there about plastic contaminants showing up in our food streams and even in our bodies now. Basically, if you are someone who eats seafood on a weekly basis, or even not, you don't have to eat seafood, but especially if you eat seafood, you consume about a credit card's worth of plastic every week, right? I'm not saying that sticks around in your body and you have to use a detox cleanse to get rid of it. It doesn't, most of that stuff doesn't get absorbed, but there are more recent studies indicating that no, actually, there are some little bits, some little chemical species associated with those plastics that may be entering our bloodstream. And then the question is, well, is that a problem? We'll leave that open for now. But there is this pervasive trend in marketing, especially online, especially in digital media, where they use fear to sell things, right? So whatever's going on, whether you're feeling chronic fatigue, vague pains, you think you're having trouble with your memory, your concentration, you're not feeling good about your mood, right? These are things that are hard to treat from a sort of classically medical point of view. So there's plenty of room to say, look, they're concealing something from you. They're hiding the establishment, the doctors, they don't want you to know about that one trick that will solve whatever problem you have, right? You've probably seen those clickbaits. The one trick the doctors don't want you to know about. And it's almost as if, there's this hidden element called toxium hiding in the periodic table that is the root of all evils, or at least the root of the evil that you're experiencing. So that's a powerful situation in which you can make sales, right? If someone has a problem that's not being addressed, and there's this sense of conspiracy or, hidden information that someone can provide you, that can generate a lot of money. All right, so I was talking about the difference between toxin and toxicant. Do either of you happen to be a Greek scholar by any chance, or do you speak Greek? I'm hoping you say no, but if you do, please correct me if I say anything that's actually not correct. But from my understanding, the etymology of the word toxin, toxicant, we're talking about a Greek root, which refers to bow and arrow. So the toxon was the bow for shooting the arrow. We have this phrase, toxicon pharmacon. So the toxin was the bow and arrow, unit, but the pharmacon here, that means the poison for use on arrows. So shooting a poison arrow at someone. So it brings up two interesting origins. So toxicant, obviously, we get toxic, toxicant. The point I wanted to make here is that technically that ad talking about toxins in your body, I don't think they really cared about the difference, but toxins are specifically things produced by living organisms. So if you eat that, stereotypical poison mushroom you found in the woods and die from liver failure, yes, you've consumed a toxin. Or if you're bitten by a venomous snake, it's going to inject neurotoxins into your bloodstream. Those are toxins for sure. How about what happens if you're worried about wrinkles on your face and you go to the dermatologist? What might happen?
Botox.
Botox. That is literally a toxin, right? Botulinum toxin. Clostridium botulinum, that's the bacterium. That's the toxin. So they're injecting a neurotoxin to paralyze those nerves that otherwise start causing us to have facial expressions. So toxins are biologically produced. The larger category is toxicants. So that includes your toxins, a small subset, plus anything else you can think of that might cause harm in sufficient quantity. So I wanted to bring that up because this other phrase or other root word, pharmacon, obviously we get pharmacy, pharmaceuticals from that. But look, it means poison as much as it means medicine. So we have a mantra in environmental health: the dose makes the poison. So anything that can help you can also harm you in sufficient quantity. Even this horrible substance, right? You probably get the joke, and this is a joke webpage, but it's to illustrate the idea that, we're talking about marketing here, selling fear. So as Amelia, I assume you just took a dose of poison right there in that cup. There was probably a large concentration of dihydrogen monoxide in there. So be careful. But, you can die from water poisoning, right? Have you heard stories about that in the news where people die? What happens? Do you guys know the physiological mechanism?
I think because they end up drinking so much water, their kidneys can't keep up to excrete that water. So it causes electrolyte imbalance. Yeah,
and that up here in the brain, the osmolar gradient, that you have dilute blood because your kidneys can't keep up. And so your brain tissue starts absorbing the water. So you get edema, and that's basically how you die, from cerebral edema. So yeah, water can kill you. It's true. It's just about context though, right? Because 70% of our bodies are water. Here's a movie I'm sure you've never seen, but does anyone recognize this actress by any chance? Oscar winner?
Yeah, her name is, for some reason, I can't think of it.
Now I'm blanking on it too.
Close or no?
Say it again?
No.
It's, we'll think of it as we go along. Back early in her career, she was in this movie called Safe in the 90s. And the director is also fairly famous. He does a lot of, Oscar quality period pieces about gender politics and things like that. Todd Haynes. Julianne Moore, there it is, Julianne Moore. Anyway, they did this movie together about, a typical housewife who's going about her daily activities, and she starts experiencing weird symptoms, right? So she's doing the gardening, and then she notices she gets a rash on her hands. She's driving the kids around, and she gets this severe migraine, and she dyes her hair and gets a nosebleed. okay? And it's a fictional account. We're talking about a character who self-diagnoses with environmental sensitivity syndrome, which is not a thing, it's just a narrative device. But the idea here is that she realizes that the world she's living in is impacting her health. She's allergic to everything, essentially. So she goes to live on this farm wearing this hermetically sealed suit, not, removing contact with everything around her, including the people, her whole family, right? And that has some resonance in the COVID era, right? Especially during the beginning when we were all quarantining and being really, really careful about the threat that we pose to each other. But this is not the type of strategy we endorse in pediatric environmental health. I'm going to try to provide a different way of looking at the world and how we are supposed to get along with it. Another analogy I like to use is the endocrine system. So another Greek root here, krinein, to separate. So endocrine, meaning separating from within, as opposed to exo, going out. So exocrine, like digestive proteins, when they get excreted into your gut, that's technically outside your body, right? It's just a tube that's connecting to the outdoors on both ends. But endo, meaning it's just staying inside in your bloodstream. So, if you think about an individual cell that might be producing a hormone, what's it doing? I mean, just in a very mechanistic sense, it's packaging up a little piece of itself and then sending that out into the bloodstream to cause a distal effect. And there's a feedback loop to the original cell. That's your endocrine system. So analogously, we can talk about perhaps the envirocrine system. So scaling up from the cell to the organism. And at that level, we do create things, send them out into the world, and there's a feedback loop, and they can come back and impact our health. Let's play Price is Right for a minute and take a guess. How many chemicals have humans invented in the last close to 100 years? Like basically since World War II, we had a big explosion in synthesizing new chemicals that really didn't exist in the world or in the universe, as far as we know, before we played with them in the lab. So Price is Right, meaning closest without going over. Amelia, what do you think? Take a guess.
I want to say, if you're counting like all the little different plastics and things like that, I want to say millions.
Millions, okay. Rebecca, do you want to go with the Price is Right strategy of guessing one, or do you want to go with something in between, 1,000,001 or more than millions?
Let's do more than millions.
Wow, you guys got anchored way out there. It's not millions as far as we know. We don't have an exact number because some of the chemicals are proprietary. We don't know all the industrial secrets, but we're talking order of magnitude about 100,000, and the estimates are around 130, 140,000 chemicals that humans invented. Now, some of those are what we call high production volume, HPV, meaning that they are produced in such large quantities. And some of them are what we call forever chemicals, meaning they don't readily break down in the environment. So if you're making mass quantities and it doesn't break down in the environment, guess what? It's everywhere. Over the decades, these things get around. If they don't break down, they just move to other places. So it can be in our bodies for sure. It can be in our food streams. It can be in our water supplies. It can be in the air. It can be in the soil. It can be in other organisms. Some of those things are out there. So that gives a very frightening picture, like the world in that movie Safe. Like all these things are out to get us. And before I get to the positive spin on these concepts, let me first talk about the risks we have for kids in particular, right? We have that mantra in pediatrics. Kids are not just little adults. They have unique characteristics that adults don't have in many situations. So I'll just give you an open-ended question. What might make kids more susceptible to being exposed to any chemical you might be thinking of? Why would a kid be more vulnerable than an adult?
Because they're still developing and growing. Their brain is developing. So
Absolutely.
To anything in an environment that they're incorporating.
Yeah, that's one of the most powerful examples, I think. When we're born, most of our organ systems are fully functional, so we can survive outside the womb, with the most prominent exception being our brains. We've made that sacrifice so that we can still fit through the birth canal, but still have a big brain. There's that delicate balance, such that now we require incredible support from whoever the parents are, right? We can't survive in the world after birth. Unlike, let's say, if a horse is born out there in the wild, after a couple hours, that horse is walking, right? That's not the case for humans. We take a lot more time to become fully functional. And you might say that we never become fully independent. We always depend on the society that we're born into. None of us is going to start inventing cars and buildings from scratch again. We are always relying on what came before us. Anyway, it's a bit of a digression, but yeah, we can interrupt normal brain development in a way that wouldn't affect a parent. So we'll be talking about lead in the next session. Expose both these people to the same amount of lead. The adult, their brain's already done. It won't really impact their brain in the same way that a child's brain development can be interrupted. Absolutely. Anything else come to mind about why a child's more vulnerable?
Differences in like metabolism. So they may, things like alcohol or things like that may affect them more than an adult.
Yeah, for sure. Metabolic capacity, and couple that with the idea that, per body mass unit, per kilogram, kids are breathing more, kids are drinking more, kids are eating more of whatever it is. So they get exposed to proportionally more of whatever is in their environment, for sure. Anything else come to mind? I don't want to be forcing the issue, but if you have other ideas. Like if we go back to to lead, why are kids more likely to be exposed in the first place, regardless of the brain harm that it causes? Why do they even get the lead exposure more than adults?
Also more curious. They might eat things that are not edible to us.
Exactly. So normal developmental behaviors for kids put them at extra risk. If you've ever wondered why we test for lead at age 1 and not like right after birth, that tells you why. Because that's when kids are mobile. At birth, if you tested their blood lead, you'd just be testing the mom's blood lead, essentially. But if you're testing their own lead, you have to wait till they're crawling around and doing hand-to-mouth behaviors. So if there's lead in their environment, it will get into their system. It's like they are the canary in the coal mine, figuratively. So we have normal developmental behaviors. We talked about metabolic capacity and especially interrupting brain development. Routes of exposure are also important. So, this dust or food or drink, whatever we're consuming through digestion, that's one way we can expose ourselves. Breathing stuff, whatever's in the air. Dermal exposure, and of course we can't forget in utero, because lots of things that the mom might expose herself to do cross the placenta. All right, so that's painting a pretty bleak picture. We're talking about the envirocrine system that we've created for ourselves, where there are over 100,000 things out there we've created. Some of them stick around forever. Some of them are ubiquitous in the environment. Are you familiar with the NHANES study? NHANES, that's the National Health and Nutrition Examination Survey. NHANES, it's a periodic study done by the US government. And believe it or not, they send vans out across the country and they ask people, hey, come on into the van. I want to test your blood. And people do it. It's legit. But they test lots of stuff. So every couple of years or so, they do the NHANES study. And we have so much data about the health of the average American based on this decades-long study. You test that blood for any metabolite you can think of, and it's there in our bodies. Any, when I say metabolite, I'm talking about these exogenous pollutants. It's in it, it's there. You test the blood, you test the urine, it's there. The question is, what's the harm? And that's a big open question. We do know some things, but there's a whole lot we don't know. So anyway, you can think about this kid being just this victim, right? Forget about the 100,000 things. What about just the natural world, right? So what risk does the sun pose as a toxicant, if you want to frame it that way?
UV ray damage.
Exactly, skin cancer just from being outdoors. This tree over here, there's two things implied from this tree that could be harmful.
Could be pollen.
Pollen, and it's on fire. So, and you know, similarly to the volcano, you might think, well, if you're in Long Island, I'm not really worried about forest fires and volcanoes, so why are we talking about it? Just this past summer, you might remember the Oregon and California fires that were, you know, huge. There was a day in New York City where the air quality index got up to 170. Anything above 150 is bad for everybody, meaning that it's a category where the warning tells you it's not just for people who have respiratory conditions. No one should be breathing this air. And we had that from the Oregon fires across the country, right? All the way across the continent. It was impacting our air quality. Volcanoes spew out other things we'll talk about in the next session. Obviously pollen, allergies. How about this in the ground? What element is that?
Radon.
Yeah, exactly. Now, Long Island doesn't have much radon. You can look on maps and see where the radon is endemic in the geology. It's not so much in Long Island. But there are places where it is prevalent. Good news about radon, yes, it does. I mean, the bad news is it causes cancer. It's the number 2 risk factor for cancer after tobacco smoke. But the good news is it's easy to get rid of if you find it in your home. It's heavier than air, the particles are. So it's coming up from the ground below you. It hangs out in your basement. And you install a little fan in the basement that sucks the air out into this tiny little pipe chimney along the side of your house and releases it above the roof line to harmless concentrations. So as long as that fan's just sort of constantly pulling out the air in your basement, not a problem. You can sell your house without reducing its value. Just an FYI if that ever comes up. But put all this stuff together with all the stuff we've made in the world, and you can see the impulse to protect children from the world around them, just like Julianne Moore in Safe, right? That's a natural inclination. There's a threat. We have to protect, threat, protect. I'm going to offer a contrary strategy. So in pediatric environmental health, yes, we do want to acknowledge specific realistic threats, which we can talk about, but the overall message we endorse is the same stuff you would endorse at any well child visit. The same stuff that any parent wants to do for their kid, providing that nurturing, stable home life, regular sleep, right? A variety of foods, all these different forms of cognitive stimulation and physical activity. When we're talking about play, you know, it's indoor, outdoor, it's alone in groups, it's structured, it's unstructured. All of these things sound very touchy-feely. Oh, like that's nice. It goes beyond that. I think you're all familiar with the ACEs study, the adverse childhood experiences. That's what we're talking about here. So if you have a child living in a home where the parents have the capacity and the time and the luxury of time to do all these things to the way that, you know, to the extent they want to, read with their kids, play with their kids, provide the food, provide the stable home life, those kids are physiologically resilient to whatever toxicant we're talking about. Now, in the ACEs study, what is the toxicant that causes all the bad stuff? Do you guys know? It's an endogenous toxicant.
Poverty.
So poverty is the exogenous condition, but how does that translate into the sort of internal problem with, like, you know, increased rates of heart disease and obesity and diabetes and depression that's associated with exposure to poverty?
Stress.
Stress, right. And how does stress manifest in our bodies? What chemical are we talking about?
Cortisol.
Cortisol. So we're talking about cortisol as an endogenous toxicant. Yes, absolutely. So, you know, the kid who has a positive living and learning and growing environment will have less of that toxic stress, less dysregulation of the cortisol. But what I'm trying to impress upon you here is that it goes beyond just cortisol signaling. So that this child who has the benefit of these good things is also less vulnerable to something as directly harmful as lead. So you have two kids, one with a positive home life and one without that support structure. Expose them both to the same amount of lead, you can guess which one will be adversely impacted cognitively. Okay, so this stuff is not just touchy-feely. This determines population health outcomes. And I think that's a good place, perfect place to leave off for today. We're a little bit early on the time, but in the next session, we're going to go into two of those particular toxicants that may actually come up in some of your clinical work, mercury and lead. And I forgot to ask earlier, do you folks know what you're going to do with your careers going forward? Do you have like an area of specialty or a geographic area you want to work in? Any thoughts, or have you ruled anything out? Go ahead, Amelia.
I want to do pediatric endocrinology, and I want to stay in the New York area.
Oh, great. There you go. So maybe the envirocrine will be the new addition to your field as we expand our knowledge of how our bodies are impacted by all these things. So are you familiar with endocrine disrupting chemicals?
Yes.
So I forgot to mention that specifically, but and sorry, first, Rebecca, do you have any career plans that you want to mention?
I'm going to go into development.
Oh, nice. Yeah, so this is relevant too. Yeah, we don't want to compromise development with these toxicants. I was mentioning endocrine disrupting chemicals. If most of us have reusable water bottles around because they're always given out as swag. You probably have your own hospital water bottle with its logo on it somewhere. If you've ever actually gone to the store to purchase one that was made of plastic, you may have noticed there's a label on it that says BPA free. You're nodding your head, Amelia. So do you know what BPA is?
That's one of the chemicals in the plastic, and it was associated with cancer and
breast cancer, right, and other endocrine related disorders. It's just one of a big category of EDCs that we call bisphenols. So BPA is bisphenol A. And do you have any idea why we had it in water bottles and why we don't have it now? Like, who cares, right? It's so breast cancer maybe, but why would we have it in the water bottles to begin with? So go ahead. Do you have a guess?
I wouldn't know early on, I guess, that it would cause cancer, and it was just another material.
Yeah, so basically we have all these things that are called plasticizers. So, you know, plastic is just the polymer that is the material. But plastic, another Greek root word, it just means formable, shapeable, moldable, right? It's just sort of an amorphous thing. You can make it into whatever shape you want, but it's floppy unless you add a plasticizer. So in a water bottle, you want rigid plastic. So BPA makes it rigid. So if you buy that water bottle in the store, you'll notice that it might be BPA free, but it's not flopping around. So what does that imply?
That it has other bisphenols.
So we had all this work done. And I say work, I mean millions of dollars of research funding. Who knows how much time and effort on behalf of community activists and you know, folks trying to change the laws to get rid of BPA. So we got, you know, we finally got a law. We had enough, a big enough body of research saying BPA is causing harm on a population level, breast cancer being one of the highlights, and enough activists to say, hey, all you elected officials, let's make a law to get this BPA out of here. And we did it. But then what happens on the industry side? They switch from BPA to BPS. And what's the harm of BPS? We don't know. It could be worse. So this is a fundamental concept in environmental health in a practical sense in this country. If you're in Europe, the burden is on the manufacturer to demonstrate safety before a product is released to the consumers. Whereas in the US, the burden is on the public to demonstrate harm after the product is released. So it's completely reversed, right? This is the myth of Sisyphus in our country, where we have to work to get that boulder up the hill. And as soon as we do, it comes right back down because we switch to the next chemical, which might be even worse. 130,000 and counting. So there's a lot to be said about policy. And that relates to the Frieden triangle, because we want to change the policies to change the context. So we don't have to put the burden on all us individuals to fight and say, I'm going to choose this water bottle or choose this type of mattress for my baby or choose this type of food, which doesn't have the pesticide, right? It's the burden on individuals, which creates all the health problems we have as a society. So I think that's a good place to wrap up, sort of sum it up there. If you're with us next week, we'll be going into the mercury and lead, as I mentioned, and feel free to contact me if you have any questions about anything we talked about so far. Enjoy the rest of your week. So again, thanks for joining and thanks for your participation.
Thank you.
Take care.
Thank you.